it's an honor to be here and support the Scleroderma Foundation of Chicago, who has 40 years.
Yeah, we've been on for 40 years.
God! It's like incredible. It is absolutely remarkable. Talking about pioneering minds, right? 40 years. So I'm a clinician, a physician. I was trained in pediatrics and internal medicine and rheumatology, and I developed a special interest in pulmonary complications of rheumatic diseases, which led very naturally to and very strongly to an affinity for health conditions like scleroderma, also sarcoidosis and myositis. We developed a foundation, a center, treatment and research center in New Orleans. I've known Stephanie for over 10 years.
Probably.
Much more. I think we first met in 2000.
At least 10 years.
At least 10 years, yeah. And so I do a lot of research in scleroderma, clinical trials, and I might tell you about a clinical trial a little bit later on that doesn't have a site in Chicago for it, and I'll let you know a little bit about that later on. But in addition to clinical trials, a lot of my research is in regard to patients' experience of scleroderma, so that we can understand the natural history and get a better scientific understanding from the patients, who have the closest lens really to scleroderma. And so in addition to learning about the natural history of the disease, also learning about the aspects of living and improving life with systemic sclerosis that may not be so obvious to those of us that may not be living with it. And it turns out that patients have provided tremendous insight into how we should follow our research priorities, number one, and how we should investigate certain areas of living. Even though everybody understood that gastrointestinal issues were a very important complication in systemic sclerosis, because we were so worried about other things and not listening to patients, there were very few brilliant talks like the one you just heard for many years when you would, we wouldn't pay much attention to it, right? So, but we realize now that this is gastrointestinal complications are one of the major life impediments to quality of life. So for a person living with systemic sclerosis. So patient insight, patient perspective, patient guidance is very important in research. So that's one part of what I do. The other aspects of what I do are related to folks that live with a health condition like systemic sclerosis, have opportunities to grow a sense of feeling comfortable with themselves and their lives while living with the health condition and navigating with the health condition. And that includes working in and doing research in mindfulness and yoga and making these sort of empowerment avenues accessible to people with systemic sclerosis. And part of this is now a focus on exercise. Are you up there? Yeah. So, and this focus on exercise has now been formed into a global fellowship looking at the various ways that moving our bodies, feeling comfortable in our bodies, can impact the course of, not to throw medicines away, but as an adjuvant, as an amplifier to standard treatment. in systemic sclerosis. And this talk is going to look at those different ways that moving our bodies, activating muscle, impacts things like circulation, inflammation, skin function, of course, lung capacity. So, yeah, let's just take a moment while we're not so biased about what I'm going to say, just to review some of our own experiences of how we feel about exercise. And I know that you have been supplied something to write with and something to write on. You can write on even the printout of the presentation if you like. But just take a moment and ask yourself, what are some of the words you use to describe exercise? It could be adjectives, it could be nouns, it could be expletives. Just take a quick moment just to reflect. Okay. And now I'd like you to just think back and recall a time where you felt beautiful when you were exercising, when you felt beautiful when you were exercising or moving your body. And then I'd like you to just reflect, if you would, if there's anything that you feel or you notice comes between you, your feelings, your desires, what comes between you and exercise. Perhaps just scribble out the first three. It could be, like I said, a feeling. It could be a real physical challenge. Anything that you feel comes, it could be motivation, it could be just being bored, whatever it might be. Okay, great. And then maybe just reflect on whether or not there are any particular fears that you hold regarding exercise or exercising. This could be anything. It could be a physical fear, it could be an emotional fear, it could be feeling self-conscious, anything. Whatever comes to your mind. Okay. So very quickly as a group, we're just going to shout out. Go to question 1. What are some of the words that you might use to describe exercise?
Stretching.
Stretching. Misery.
Sweating.
Sweating. Good or bad? Whether that's good or bad.
Empowerment.
Empowerment. Mobility.
Self-care.
Self-care.
Energy.
Energy. Strength.
Daunting.
Daunting.
Tiring. These are the
Tiring. This is the realistic lady here. I was thinking everyone was being so positive. This is the first. And these Chicago people, man, they've got resilience. Necessary.
Painful.
Yes.
Painful.
Yeah.
Painful. Yes, ma'am.
Fun.
Fun. Yes. Okay. Thank you. Did I mishearing somebody? Okay. Thank you so much. Recall a time when you felt beautiful exercising. Does anybody want to just briefly share? For example, I can say I was at my sister's wedding dancing my butt off. And that felt beautiful. Anybody else?
Oh, when I was much younger, I had prefaced it by saying that when I was running track,
Running
after,
track.
yes, I felt like I was like at my peak and I was just like a gazelle and I felt beautiful.
Wow, I can feel that. What a beautiful depiction. Anybody else want to share? Yes.
Mine is hiking, biking, or kayaking, anything outside.
Feeling the breeze on your skin and the sound of the nature. Wonderful. Yes. Anybody else? Okay. Is there anything that comes between you and exercise that you might want to share? I can share. You know, I don't really appreciate going to the gym because I feel so out of place. That's my contribution. Anybody else want to share anything? Cold.
You might not understand.
Cold. Cold, yeah.
Time, yes.
Time.
Yes.
Time. Yeah, time can be a bully.
The thought of soreness afterwards.
Soreness afterwards.
And so for me, sometimes it's, what exercise should I do? There's so many things to do. The choices are endless.
Yes.
Yes.
Yes, it's so true. It's getting even to the decision
Yes.
that can even demotivate us from doing anything.
Yes.
Right. Okay. And then, are there any particular fears one might have about exercise? We heard one that is often discussed, which is feeling sore afterwards.
Falling.
Injury, falling. Somebody said cold before, feeling cold and getting a Raynaud's attack, perhaps, because you're feeling so cold. Anything else?
You don't feel cold because you're exercising, you feel cold because you're outdoors.
Yes.
Oh, being outdoors.
It's cold out there.
Yes. And so prevention is so important to think ahead. And I know Stephanie sent out a couple of PDFs, articles, and in one of those articles it addresses prevention of Raynaud flares and attacks. Anybody else?
I have worries about my hands because gripping sometimes is hard.
Yes.
Or, you know, yoga, you can't do.
Yes.
So
Yes.
I worry about not being able to do it right or effectively.
Yes, right or effective. And that's a really good point, worrying about not being able to do it right or effective because of maybe some limitations. And hopefully we're going to be able to address everything that's come up in some way. Thank you, everybody. Okay, so what we're going to do today is this is an overview. Virtually all scleroderma manifestations benefit from exercise. Exercise has a general for our whole self and for the general population, as well as targeted benefits in systemic sclerosis. So just like you might take a PPI or now a PCAB when they come out for reflux, there are targeted exercises that we can use to help ameliorate and help even heal. For example, digital ulcers and increase circulation and maybe even reduce dryness of the mouth. So we're looking at both the general effects, health benefits of exercise, as well as using exercise as a targeted treatment to manifestations, specific scleroderma manifestations. Okay, many types of exercise benefits scleroderma. We heard different things: hiking, kayaking, dancing, yoga, many different types. And so we're going to look a little bit into those different types. And it's a matter of finding what gives you pleasure and just deciding, but just to decide to do it and do something. Whatever it is, it's all going to be good, pretty much. Pretty much. All safe physical activity is modifiable and beneficial. So this goes to Nancy's concern that the fear of what I'm doing is not going to be effective because I'm not doing it right or I have certain mobility impairments. All safe physical activity and exercise is modifiable and beneficial for people with systemic sclerosis or any health condition that might have impairments of mobility or hand function, foot function, etc. Exercise exists. We're going to talk a little bit about stretch, strength, aerobic, and endurance types of exercise. You are your body's connection. You are your own guru. So, and approaching exercise, the hope is to cultivate and habituate a self-kindness and a support, because exercise is necessary for better health in systemic sclerosis. And we're going to talk a little bit more about habituation. And then we're going to do very briefly, just because Stephanie asked me to, a very brief overview of some of the concepts of scleroderma itself, sort of like a Scleroderma 101. So, self-guru, everything you need to know is inside you. What you see, what's on offer outside of you is lagniappe. Let me say in New Orleans, you know what lagniappe is?
No.
A little something extra. so everything else, so you know it feels good for your body. You know from reading in your own inner self what good exercise is. And there's going to be a whole smorgasbord of things now, especially because of the online offerings that we could partake in. So it's just kind of whittling down to each day making a decision as to what you're going to do and enjoying it and trusting yourself and having pleasure. Okay, so I want to just briefly talk about, there was some research by my colleague in Sweden, Henrik Pettersson. He did lots of patient perspective work in systemic sclerosis and how patients perceive and experience exercise. And so these were some of the results of the research. Patients felt that they had improved blood circulation, particularly in the hands, feet, and they had prolonged core warming. Core, your central body. Now, we don't have science on this, right? But it seems to make sense. We don't have actual research results on this, but it seems to make sense that if the body is warmer, the extremities are also going to likely be warmer or slower to having an attack or a prolonged attack. This is not science. This is hypothesis that makes sense, right? So, and this is what patients perceived also. They felt their breathing improved as well. Fatigue improved, and there is feeling sore after exercise a lot of the time, and there is feeling that kind of exhaustion. And maybe even the next day, if you've overdone it, you are going to feel fatigued. But generally speaking, if you've got your hand on the thermostat and you're listening to your body's, thermal, I don't want to say thermal because it might throw people off in terms of temperature, but if you're listening, you've got that inner guru going and listening, you're going to find more than likely that when you hit a sweet spot, and then you hit in a sweet spot for intensity, overall and generally you might improve in terms of your perceptions of fatigue. Pain appears to be improved. It's hard to begin exercising in the day when we feel pain. And however, the paradox is that the more we move, the less pain that we are going to feel in joints and in muscle. And what causes pain is stiffness setting in. And movement helps to bring circulation to those areas, which helps to take away toxins that build up over times where we're still, and increases lubrication of those tendons and joints. And when we move muscle itself, I'm going to have a slide on this, but the muscle is a powerhouse factory of compounds and chemicals that help reduce inflammation and help increase other positive profiles. So even though we think of muscles as being Popeye, we really need to think of muscles as being, friendly community pharmaceutical companies that aren't out to get you. Okay. And sleep. So sleep is essentially important. This is all patients reporting. When I exercise, I sleep better. And sleep is essential for good immune function, good brain function, making healthier choices for ourselves throughout the day, helping to mitigate sensations of depression and anxiety, and we all feel those feelings. And so part of it is just acknowledging that we feel that way. But sleep is a master blanket in our life to help us restore. And folks say they have better vitality and musculoskeletal function. And interestingly enough, patients reported that engaging in physical activity and movement helped to improve social confidence and body satisfaction and self-image. So these are patients. So other findings related to his work was that in addition to patient interviews, he actually did muscle testing and other objective and subjective instrument assessments. And he found that patients with systemic sclerosis generally do have a reduced muscle strength, and a reduced muscle endurance, especially in the hips and the shoulders. So what's the difference between muscle strength and muscle endurance? Endurance is a kind of strength. So you can have sort of momentous strength where you can put force behind something, or you can have something that you have to keep up, like if I have to hold my arm up, or as my friend Dr. Helena Alexanderson developed one of the really first exquisite instruments to assess endurance in people with muscular problems, is just doing something like this. You can figure out if you're having an endurance problem, or this, or so it's a repetitive exercise, or it's an exercise that's held, and endurance really seems to be the Achilles heel for people with myositis and people with systemic sclerosis. And generally speaking, people with systemic sclerosis had impaired ability and reduced cardiopulmonary reserve. That means heart and lung function. And then a common experience is among people with, generally speaking, if we were going to categorize these experiences, is that people persistently expressed hopeful perceptions of exercise. The more I exercise, the more improved my health and the chance to survive longer. And then inactivity was consistently connected with further decline in health from patients' perspectives. Over here. So because of my lung disease, I've been close to death a couple times, so I noticed a big difference between exercising and not exercising. It is as different as day and night when I exercise. So, however, despite perceiving exercise as essential for life and health, the majority of patients perceiving the benefits of exercise, the majority patients also report not engaging in exercise. So it's really important for us as clinicians to understand what those barriers are between people who will benefit from exercise and them actually being able to exercise and feel comfortable exercise. And so multiple demotivators would include manifestation-related, like for example, digital ulcers and dealing with equipment, joint pain, restricted mobility, feeling safe, fear of falling, constitutional effects of disease like pain and fatigue, and those not only physically influence but also mentally can be a hurdle to get over. Psychosocial struggles of living with systemic sclerosis, generally speaking, can be an interference, fear and lack of exercise safety, and logistical burden of preparing and participating for exercise. And the other issue is that people living with systemic sclerosis, they really wanted more input from their clinicians and guidance as to what was safe exercise. Okay, so very quickly, we're gonna just here take a break. Okay, and now let's switch to our sponsors. Okay, so this is just a little interception because just to give a basic overview of systemic sclerosis quickly, as a special request to dear Stephanie. So epidemiological factors, I'm going to go very quickly. So we're not sure how right this is because I think we miss Scleroderma so much of the time in diagnostics. And many people live with systemic sclerosis and end up not knowing it until it's too late or no one ever really knew. But organizations like the Scleroderma Foundation of Chicago have been remarkable in raising awareness, and it's awareness that gets people into early appropriate treatment and progressing and staving the progression of the health condition and its manifestation. So I know you know your extensive fibrosis, vascular dysfunction, and can contribute a significant amount of morbidity or mortality. We'll talk about that a little bit more. You know, I'm not going to talk so much about these numbers because, you know, it's still anybody's guess, really. And probably the more awareness continues, the more we're going to see it's possibly more prevalent. But one thing that I do want to say is that there are subgroups now that we're noticing, particularly in African descent, whereby the onset is earlier and the course is more severe. And so it's really essential to, if we're clinicians, we try, and now we're realizing this may also be true of the Hispanic population and the Asian population. So there's something related to the genetics and epigenetics of systemic sclerosis that makes these populations specifically more vulnerable to a more severe course. And up to 90% of people with systemic sclerosis, no matter what your antibodies are, no matter if you're diffuse, no matter if you're limited, will have some interstitial lung disease, whether it's active or not, whether it's just sparked a bit and burned out. That's just what it is. So just to go over diffuse versus limited very quickly. So in terms of but in any case, so diffuse is the way these they're contravances really, and we're subtyping in order to be able to maybe see some patterns. But in diffuse disease, the skin above the elbows, above the knees, and involving the trunk is involved. And so when we talk about limited and diffuse, it's simply a characterization of this, how much of the skin is involved. That's all. There are some conditions like pulmonary hypertension that we think might be more closely associated with limited, but these concerns happen in both, and also in the category of those without much skin involvement at all, or any, called scenic, no skin involvement. And why is this important to know as a person living with systemic sclerosis? Because very few doctors understand, very few rheumatologists really get it. And you know, we get bits of information, it's so hard to know everything. And so when you have a rare disease, you really have to know to be able to guide the ship. You really have to be able to say, look, I know I have diffuse skin disease, but, I happen to be African American, and I know that I can get pulmonary hypertension early, even if you're not afraid of it for me, but I know that's the case. And so you can have these frank discussions with your doctors, and a good doctor will appreciate the help and the eye-opening awareness about these things so that they could better help in screening and preventing complications and preventing the disease from progressing. Okay. So this is just a quick little cartoon just to everyone, where does this come from? Systemic sclerosis. So it begins in somebody that's genetically susceptible. And, I may be genetically susceptible, but I may not develop systemic sclerosis, right? But it's usually in somebody who has genes that are vulnerable when modified, it can be triggered. And so that means triggered by environmental factors, whether that's bacterial, viral, chemical, whether it's one and repeated of the same. We know that it's more than one usually, but whether it's the same one repeated again and again, or it's a combination, we really don't know. And then what happens with this repetitive effect, there's an immune activation which goes on to cause vascular damage, and that further, where are we now? And then also environmental effects cause vascular damage. So all of these are converging because ultimately systemic sclerosis is a vascular disease that incites inflammation and autoimmunity because it's a disease of vascular injury. And then that sets off machineries that end up creating more inflammation, poor repair of blood vessels. The blood vessels get scarred, they don't repair themselves well. And then there's fallout and other mechanisms that are engaged that end up causing fibroblasts that cause scarring and fibrosis. So these fibroblasts, that you can see at the very end on the right-hand corner, these are wonderful cells when we cut ourselves because they rush into repair. But in systemic sclerosis, they can be overactivated by the earlier events, and that results in scarring and fibrosis and poor healing, and we can't get them to be less enthusiastic without pharmacological treatment like Cellcept or mycophenolate or rituximab, for example. Okay, so I don't want to talk about that, but this is what I do want to share with you, because this is a really important concept to understand as a person living with systemic sclerosis and many other types of autoimmune diseases as well, is that we have time and we move through time as a person. And we may start out with healthy tissue. When the mechanisms of a systemic sclerosis start turning and the wheels start moving and the tissue starts to get involved, there's a pocket of time in the progression of any area where systemic sclerosis is involved where there's inflammation. Now, inflammation is like a fire that you can put out quickly. You can light it, right? But if you let it go on and on and on and on, it's going to burn the embers of the house and leave charred, and destroy bits of the structure, right? And so that's kind of the concept of what happens in systemic sclerosis. That's why it's so important to get diagnosed early and to receive early appropriate treatment. Because the longer inflammation goes on and the longer the mechanisms of the fibroblasts begin to get engaged and start to lay down scarring, then the more we're accruing scar tissue and damage. Do you see where this is going? So this is and one of the things is that this is not a paradigm this is the paradigm of systemic sclerosis, but it's not a paradigm that many clinicians are familiar with. So it's essential that as a person living with systemic sclerosis understands these concepts and are able to have this as a point of power and self-advocacy in discussions with patients. And this is actually one of the reasons why it's really important to have a local rheumatologist, but also be seen at a scleroderma center, if not twice a year, then once a year, where complications and these kind of subtle points are really something of everyday clinical care at these centers, whereas a general rheumatologist has so much on the plate in terms of spectrum of disease, etc. So, and most local rheumatologists are really happy to share care with a scleroderma center. So the PDF that Stephanie gave you talks about this and has a similar diagram in there. And so the other thing I'm going to say is that systemic sclerosis and the progression of systemic sclerosis moves differently for different people. So for some people, it might be really robust, move very quickly, be very obvious, really get the attention of the clinician, and the clinician wants to do something about it. Then there are other people who live with systemic sclerosis whereby the disease is quite a bit slower, and well, everything looks okay. Oh, your fingers are bothering you a bit? Okay. But really there's nothing that's really bothering me until it goes like this for years and years and years, and you're still moving down you know what I'm saying? So it's really important not to, as a clinician, it's important not to feel comfortable. You as a patient should always try to feel comfortable and beautiful in your body and stand up for yourself. But as a clinician, it's our job to be vigilant. It's our job to think, could this patient, even though they're a limited disease, could they benefit from being on mycophenolate, which we know decreases inflammation, which we know decreases progression to scarring. It's both an anti-fibrotic and an anti-inflammatory. And we suppose, based on collective anecdotal experience, that if we treat people early, we might be able to prevent a lot of complications such as gastrointestinal involvement, that extreme gastrointestinal involvement, et cetera, because these are things that build up over time. Okay. I'm going to just pause right now. I know we don't like to do questions, but is there any burning questions? Because this is a really important concept to understand. And any burning questions about understanding this? Okay. So after having said all of that heavy stuff, what I want to share with you is another point of advocacy. So in 1959 to 2002, death in systemic sclerosis increased. This is US Census data. And then we see a dropping down. And what happened when mortality began to decrease is that we started using cyclophosphamide and mycophenolate, and survival increased. It increased for certain populations more markedly than others. This is the United States. So, we have disparities. We live with disparities. And so as clinicians, we have to be vigilant about different groups that aren't maybe being treated as rigorously, not getting enough attention. But definitely, with the onset of mycophenolate and cyclophosphamide, we saw increase in survival, and what you're seeing in front of you is that downward trend is a decrease in mortality. I do want to say here and now, a lot of this mortality might have been related to, that we're looking at might have been related to renal disease, lung disease, interstitial lung disease is associated with the highest cause of death, and followed by pulmonary hypertension. But what I want to say here is that wonderful curve that we see moving down is because we had those wonderful treatments. And there are new treatments on the market. And here's another thing about going to a scleroderma center. The scleroderma specialist is going to understand the subtleties of these studies. You know, a number of us felt like we have a risk because there's a great new drug that's out. It's called OFEV, for example. It's an antifibrotic. But for a person, and the way the study was done, what it showed is delayed progression. You're still progressing, but at a slower rate. Whereas with mycophenolate and cyclophosphamide, what was shown was improvement. Those are two completely different endpoints, right? So, but what we had was a lot of folks, pulmonologists and rheumatologists, that really didn't get into the nitty-gritty of the studies to see the differences here. And we're, you know, it's so easy to be blinded by the pharmaceutical companies that come into our offices that, oh, we're going to start everybody on OFEV, you know, that has lung disease. This is a point of self-advocacy. So everybody with progressive lung disease, really, this is not OFEV is not a first line. It's okay to put on top of something. It's only for people that have just a little bit of lung loss over a period of time, not somebody who's really progressive. So I'm talking about this because we've had such a win, and then there was a fear that because of advertising and misunderstandings in how to use medications, that this beautiful downward trend in mortality could be at risk. Okay, moving right along. But we also had another question that was regarding when we exercise, and you might have noticed this in the 6-minute walk test, that when you do a 6-minute walk test, sometimes you don't pick up the oximeter. And that's because sometimes there's a diversion of blood from the fingers. And it's true that if you have a great deal of fibrosis in your fingers, there's less blood supply, or it's more difficult for blood supply to reach your fingers. But one of the issues is that the more that we exercise, the more we build capacity in our bodies to share blood with the rest of the body, if you see what I'm saying. So when our muscles in our bodies get stronger and more vascular, we don't need as much oxygen, and we can share it. And the muscles can share it. Okay, so yes.
Oh, could you, this is going back to when you were giving the introduction to Scleroderma. Would you be able to speak to, what's it called? Comorbidity?
Oh, did I say that word? I'm not
No,
sure.
you didn't, but I was just wondering if you have anything to offer about that.
Comorbidity?
Yeah.
So comorbidity means a health condition that one experiences alongside another health condition. So, for example, if I had diabetes, I might say, well, I also have osteoarthritis, so I have a comorbidity of osteoarthritis. So, but as we're looking at systemic sclerosis right now, we're talking about comorbidities that aren't necessarily related to systemic sclerosis, the way that osteoarthritis isn't necessarily related to diabetes. So comorbid. Morbid means unwell. It means ill. It's not a very nice word, is it? We need to find something else. So, but it's like a co-condition that's not directly related to the primary condition. So a comorbidity in systemic sclerosis might be headaches, because it's not really considered part of the disease. You could have headaches, so you go to see a different doctor for that type of thing. Whereby, for example, gastroesophageal reflux is a complication of systemic sclerosis, not necessarily considered a comorbidity. You see what I'm saying? It's more a complication of the primary disease that needs addressing as a disease as a whole. That makes sense.
Yeah. So I gather there's no common things that come together for most people or anything like that.
Yeah. Okay. Yes. Great. That's a really great summary. Thank you. Okay, so here we are. We're going to talk about exercise being medicine. So here's this picture of the muscle that I wanted to share with you. We're not going to spend too much time on it. It's a very busy slide. But you know what? This is like a spit in the ocean of what these muscles really can do and what they produce and the different mechanisms that they're involved with. There's so much crosstalk, that contraction of the muscle and the juiciness it produces. It has so much crosstalk with various organs, like the brain, the liver, the gut, glands, our glandular function. And our immune system, modulating our immune system, and having the ability to downregulate inflammation. So it's crazy, it's wonderful, it's amazing. Muscles are really amazing, and I really feel this is the decade of the muscle in science. There's going to be a lot. And somebody asked me about a particular type of exercise called restricted blood flow exercise. We don't really have data in scleroderma, but we have data in other diseases. And we're looking at it. But there's other ways right now that are more immediate to everybody and more important without waiting for data that in a particular intervention that might, asks a lot of the patient, quite frankly. It asks a lot of them, that particular intervention. Okay, so, come back. Okay, so this is our group, and we are G-Force, the Global Fellowship on Rehabilitation and Exercise in Systemic Sclerosis. And this is where we're casting our attention. You might notice that one amongst you, Nancy Baldwin, is part of this group. We have a number of patient partner researchers in this group. And we are dedicated to supporting research and science in exercise as medicine, not to replace medicine, because we can never. I would give my life to keep mycophenolate available because it means so much to so many people. But this is to accelerate its efficacy. Okay, so moving the body, we've talked all about this. Decreases circulation, it decreases inflammation, lubricates the joints is so important, and the biochemical impact that it has on the brain. It just can't be, there's no words for it just yet. It's incredible. And its impact on sleep, when we talked about the importance of sleep. And so one thing that's really important to understand in systemic sclerosis, you may have the best set of lungs. Two individuals have the same, let's just say, they were twins in terms of how systemic sclerosis impacted them. The same set of lungs, the same extent maybe of fibrosis or pulmonary hypertension, and they're doing great. The person that allows themselves to move their body is going to experience more energy, more ability to move through this world physically, in terms of mobility, in terms of interfacing with various activities, etc., is going to feel generally a lot better. And when we move, we tend to experience our symptoms differently, more positively, perhaps. But also, our symptoms just may get better when we move, because they've got so much. Have you got the finger in every pie? Our muscles do, in terms of inflammation and pathways related to pathways that are very important in systemic sclerosis. Okay, so if you don't know this wonderful lady, Janet Poole, can you raise your hand if you know her? Heard of her? Come on. Yes.
I did a
Thank you.
study with her.
You did the either the workability or the fatigue study? Workability, awesome. This is a very important lady in systemic sclerosis. On the PDF of the article that you have, there's going to be some links there for her. She has a couple of management programs as well as videos for oral facial exercise and hand exercises. These are essential. And why do I have ASAP up there? Is because based on preliminary data, we know that if we can get people with systemic sclerosis to start exercising their hands and their face earlier, we may prevent the onset of worsening hand disease and reduced function. So it's very important, and everybody's case is individual. So it's really important to get into pointed discussions with your clinicians, rheumatologists, about early referral to occupational therapy, hand therapy, physical therapy. And then you may not have to go every week, but you continue a check-in and a relationship with these people because they're going to help you have the power. Okay, so I wanted to talk about the diaphragm. Diaphragm, very, very important because it's a huge, big muscle, and it splits your torso. And above the diaphragm, you have your lungs, and below the diaphragm, you have your gut and your pelvic organs. And so the diaphragm, being a muscle in and of itself when it's used, it also emits these wonderful things. So that's a lot of prime property, as I guess they say, right? So you're engaging with a lot of prime property right there. And every time we move and exercise, when we sing, when we chant, and we're engaging this muscle, we're causing it to also exude these wonderful substances. But in addition, I want you just to have a look at where it sits and where it's attached. So the diaphragm, as a huge muscle, it attaches to the lumbar spine, back to the lumbar spine, and it also attaches to the sternum and the upper spine. So what we have here, inexplicably, is a core muscle. The diaphragm it's not even arguable, but we never talk about it because, how our diaphragm looks doesn't affect how we look in a leotard, right? so that's why nobody's talking about this magnificent core muscle, but it is accepted as a core muscle. When this muscle is better coordinated and stronger, people have less back pain and they have less falling. Very important for people with systemic sclerosis, for which there's a higher incidence of falling because of mobility issues. So it's very important for those reasons. So again, exercise is a rhythmic thing usually, and the rhythmic experience is because of the diaphragm. So the diaphragm is working, singing, chanting. These are all engaging the diaphragm. So here's some other things that I want us to think about in terms of the diaphragm. When the diaphragm contracts and releases, what we have happening is we have mechanical pressure down into the gut. We can feel that right now. You can put your arms like this, or if you can, put your arms like this. I like to sometimes put when I'm really anxious, I like to sometimes put my arms right over my ribs, and so that I can have the diaphragm feel my diaphragm breathe against my hands, and that tends to calm me down. But I just want you to feel the diaphragm. You can even hold it, because holding it feels good. Sometimes that can bring me right down when I'm just like spinning out of space with my thoughts. But so one thing is that the diaphragm, with this alternate relaxation and contraction, creates a mechanical pressure differential and a hydraulic pressure differential, as well as these pressure differentials stimulating neurohormonal chemicals in baroreceptors and pressure receptors throughout the body. And one of those areas is the vagus nerve. So, and that's very important for self-regulation, right? Everyone knows about that now. But the other thing is that if we think about the gut, that helps with gut motility. That's a massage that helps with gut motility. moving our bodies can help us feel less nauseated. So taking some of these things into account, if you talk to a cardiologist from India, for example, they will share information that they've known for years, that doing breathing exercises can cause a massage of the heart. They believe can create massage of the heart, help it be conditioned. Well, we call that something else, very scientific, but also like massage the pancreas, for example, and can help with hormonal glandular issues that we consider to be related to diabetes, for example. So old medicine is new again, and new again. So yeah, so yes, so let's move on. So another really important thing about exercise. Everybody has heard of the microbiome. Should I say something? No, okay, yes, thank you for shaking your head no. Microbiome. It is the many splendid, wonderful organisms, or sometimes not so wonderful organisms, that live in our gut, that populate our gut. But it's also on the skin, in the mouth, etc. But right now we're thinking about the gut microbiome. And the gut microbiome, there's a plethora of studies that have demonstrated that it impacts association with certain diseases, and Scleroderma is one of them, so that if your microbiome is not sufficiently diverse, that could be associated with any number of different diseases, and systemic sclerosis is one of them. And what we can do is we can replenish the microbiome diversity by the foods that we eat, and also by exercise. So through the types of food that we eat and through enhanced exercise, we can diversify the microbiome. And so why is this important? Well, the microbiome has impact on, it seems, our feelings, how we view the world, depression, the degree of depression, and they've even been able to sort of tie it to choices and the ability to make choices. So now the gut is being called the third, not the gut, but the gut is like the second brain, and the microbiome is being called the third brain, because it's like we have bacteria telling us what to do. But when we have a healthy, happy family, a diversity microbiome, then it seems that this impacts selections, how we view the world, like I said. But what it also does is, in addition to being associated with a number of different diseases, one of them is cancer. And so there have been really wonderful studies that have been done, paid for by your and my tax dollars, thank you, that demonstrate that when we exercise, and this has sometimes been linked to the microbiome, is that there's a reduced incidence of cancer. This has been shown in a number of different types of cancer, breast cancer, GI cancers. And it's been shown that people who have a past history of cancer, when they exercise, engage in exercise, they have a reduced risk of recurrence of that cancer. Pretty mind-blowing. So when this lady said necessary, do you remember you said necessary? Okay, you were. I'm so glad you weren't going to gaslight me and tell me. No, I didn't say necessary. What are you talking about? Yes, so it really is necessary for so many reasons, but this is just another one that goes into this huge pot of living, loving, vitality of life. Okay, and things that increase mindfulness, singing, moving the body in motion, all of these things also help to increase the microbiome. Okay, and more work is being done on singing. So who can exercise? Everyone. What? You guys are nuts! Yeah. Everybody can exercise. Exercise happens where we're at. Everybody can exercise. Everybody can exercise. It doesn't matter if we're, if for some reason we're confined to being in a bed for a while. everybody has some scope of exercise, and even engaging some muscle tone is helpful for a number of reasons, not just for your muscle, but for your bones and for circulation and your immune system and your brain. Like right now, everybody, just wiggle your toes. Scrunch your toes if you can. If you can't scrunch your toes, think about scrunching your toes. Don't you even feel better doing that? Okay. Yeah, so it's special like that. You can exercise anywhere. Okay, so people with systemic sclerosis that don't have any pulmonary or heart involvement, they can exercise without restriction. Now, if people have cardiopulmonary involvement, we know that they benefit. And we know that exercise is feasible and pulmonary rehab, cardio rehab is reasonable. But there's also home exercises that folks can do. And everybody should have appropriate screening. And this is one of the reasons that if you're not being followed by a Scleroderma center, folks can have haphazard screening. And so they may not know exactly, where they have been in a cardiopulmonary status for the past 6 months or past year. So screening is really important to know, because then we know if somebody's really high risk, like for example, if they have moderate pulmonary hypertension, we may want to just let them do gentle exercise at home without intensifying, but getting them into cardiopulmonary rehab where they can learn how to supervise themselves and care for, and be able to exercise like everybody else in a healthy, safe way. And part of that screening that you should be getting is asking about your symptoms, yes. Breathing tests, yes. 6-minute walk tests, yes. An annual echo every year, an echo. We like to do exercise echo, and you should know that the cutoff for pulmonary hypertension is actually lowered. So that's a little out of date on the PDF that I sent out. It's lowered now by 2 points. So, but you can look that up. So people with mild pulmonary involvement can exercise. It's safe to engage in moderate aerobic intensity with moderate load resistance. And we're going to talk more about that. Patients with myopathy, muscle involvement, exercise is good. They may need more targeted support from a physical therapist. And I believe that people with myositis and myopathy, as many people with scleroderma have, should see a physical therapist to be assessed and to help with targeted the word, to help rebuild muscle. Okay.
Could you clarify how you know if you have myopathy?
So that's a very good question. So you may feel it. You may feel it like when you're washing your hair. Your arms get super tired. You may find it when you are getting up and out of a chair, for example. That may be, and if you feel it's because of weakness in the muscle rather than instability of the feet. But it seems that a good percentage of people with systemic sclerosis will have some myopathy, whether it's a little bit or a good deal, is really the difference, I think, of whether someone should be going to a physical therapist without question. But it's really important. So a muscle test, but again, these muscle tests like this, 1, 2, 3, 1, 2, 3, 1, 2, 3, that you've had, like lift this and press down. Sometimes they don't reveal that in people with myositis and scleroderma, which is why an endurance test is a better way of knowing if you're having muscle involvement. And there's things like muscle biopsies and EEGs, but the muscle biopsies and EEGs are painful. We know people experience myopathy, so it's important to look at some lab values, maybe like the creatine kinase, which is a muscle enzyme, aldolase, which is a muscle enzyme, sometimes the quote-unquote liver enzymes will be elevated because those are enzymes that are shared by the muscle. So muscles have some of the same enzymes as liver. So those are some clues also.
Thank you.
Yeah. So overview of potential exercise benefits in males and females with systemic sclerosis. And so this is another opportunity to journey through manifestations of systemic sclerosis. Also, it's combining a little bit of Scleroderma 101 and the exercise portion of this presentation. So aerobic capacity, cardiopulmonary fitness. So we know exercise improves cardiac function, cardiovascular health, pulmonary vitality, and your thoracic shape. So when we exercise and we move our bodies, our posture gets better, our thorax tends to be more expansive and open, and that helps with breathing. That also helps with outlook, right? So there was a psychologist called Nina Bull in the 50s, and she started doing this work. Can everybody just lift up their arms? And if you can't lift up your arms, just do what you can, just wherever you can. How does that feel? Okay, good job. So her argument was, and unless it causes you pain, her argument was that when you lift up your arms, that can switch your emotion. So, because it's hard not to feel joy. And it's a little bit harder to feel joy.
True.
But it's important to be introspective sometimes, so this means something. And this is what we do all the time when we're on our phone. So it's more important to integrate, right, to counterbalance the Verizon, AT&T, etc. extravaganza that's infusing our lives. Okay. And so we were able to cope when we exercise. We're able to cope with feelings of dyspnea, which means shortness of breath. So we are able to cope with the extent of dyspnea that we feel. Why? Because actually our muscles are picking up some of that workload. Okay, more. Okay, the diaphragm strength, we talked about that already. Muscle strength and endurance. Joint stability. When the muscles are stronger, the joints are stable and safer. And when we move, even if we move our ankles, even if we squeeze our bottoms in a chair, we're helping all those ligaments to get lubricated and feel more at ease. Our balance gets better and our bone health gets better. So when we contract muscle, that stimulates chemicals that strengthen bone underneath it. And even in a teenager who might have been in an accident, for example, that's in bed for 3 weeks, without moving their muscles, they lose bone mass, even a teenager. So this is how important muscle contraction and activation is in our lives. Circulation, we talked about it, peripheral warmth, core warmth. I just want to go back to that comment that was made about the muscular steel of the oxygen in the blood when we're moving. It's really important when we're exercising. If you know your hands tend to do that and get cold, that we think ahead and be prepared. Wearing gloves, etc. And making a statement in the gym. You know, making gloves the new Uggs or whatever it is today. And it's so important for wound healing and wound protection and sweating. So one of the things about sweating, not everybody, when we have systemic sclerosis, sometimes it's harder to sweat. One of the things, though, is that when we sweat, it seems like that's one way that our body gets rid of inflammatory cytokines, is through sweating. So that's one good thing about exercise, too. So inflammation reduction, we talked about these pathways of fibrosis, breaking down of the extracellular membrane that can be activated with exercise. anti-infective, anti-carcinogenic functions. We talked about carcinogenic means cancer, and also anti-infective. But so when we move, we're more likely to be able to resist infection, pretty much everywhere. GI function, we talked about how that impacts in the diaphragm, but also the muscles themselves deliver important feedback to and healing properties to the gut. Third, oral health. We didn't talk too much about oral health, but facial exercises, singing, these help to increase circulation and increase all of the same things that we're talking about in the body to the face, to the mouth. And there's been studies that show that exercise can improve salivation in the mouth. And I think there was a study in singing also, and that makes perfect sense. And people experience TMJ in systemic sclerosis, so which is the jaw pain and jaw tension. So something like singing and the mouth and face exercises of Jen and Poole would be helpful. And again, hand function and skin repair of the hands. So in terms of quality of life, it's incredible a little bit of exercise can do for ourselves and our relationships. Overall physical function, our mental health, our stress reduction, sleep quality, fatigue reduction, body pain reduction. We learn about our bodies as we move. That's the other thing. It's a relationship thing. It's a growing thing. And sexual function, because a lot of sexual function is a mind experience as well as a vascular circulation experience. And so I want to say this about exercise. I want to qualify that when we're talking about exercise, that it's, number one, it's a powerful adjuvant. Meaning, what's an adjuvant? Something that goes along with a main therapy. It is not that if you exercise enough, if you kill yourself with exercise, you don't have to take any medicine in systemic sclerosis. That's not what this is about. This is about respecting it as a powerful instrument to assist other medications that may need to be taken. And then the other thing I want to say is that exercise being an instrument of peace, of self-regulation with yourself. It's about deepening our relationships with ourselves. It's not about bullying ourselves and making ourselves perform. And of course we're going to feel disappointed. Of course we're going to feel frustrated. But we have to befriend ourselves. If we push ourselves too much beyond what our guru knows is good for us, our inner guru, our bodies are going to know that we're bullying it and that we can't be trusted. So we have to create a trusting and kind reciprocity relationship with our body. Does that make sense?
Yeah.
Okay. Oh. Okay, so there's 5 types of exercise in systemic sclerosis. And you have, you have 5 types. The first type is the special type, right? Where that's special for you as a person and it's special for systemic sclerosis. It may be facial exercises, it may be tongue exercises, it may be certain types of hand exercises. So S for special. Aerobic is what we often think of as cardiopulmonary circulatory, where we get our heart rate going up. So that's A. Strength and resistance. A little bit of lifting, a little bit of resistance, like, oh, that's resistance. And stretching. So far we have SAS. And balance is very important. That's the other thing. So we've got SASP. Okay? So this is a way of remembering all the different components of exercise that might mean something to you. What's special for you given your health situation? Aerobic, strength, stretching, and balance. Okay, so here we are. So what's the difference between physical activity and exercise? Well, every little movement that we do, everything we do is physical activity pretty much. Anything that accelerates our heart rate a little bit. Like, so even I could be still here, that's not exercising, or that's not physical activity. But I can walk, and when I walk, it's affecting my cardiovascular, So even if I go to get post, or even if I'm washing the dishes and I'm moving my body, it's exerting some need for my cardiopulmonary system. So it's anything, walking the dog, gardening, vacuuming, tidying up, setting the table, all of it. And the more we move, the better off we are. Every little movement that we do is beautiful. Because it's not about calorie burning, it's about conditioning and keeping the body moving and flowing. Think about kitty cats. And then exercise is within the domain of physical activity. Exercise is a certain type of physical activity. Exercise is a plan, even at the last minute, even if you don't know what you're going to do online. I'm talking to you, like, oh my God, am I going to do this yoga video? Am I going to do that Pilates video? Or am I going to do that Zumba video? But you make the choice, and you do it. So you're planning some activity that's going to get your heart rate up. So it's planned, targeted exercise that has the intention of improved health. So it's a physical activity. And then there's our SASB. So we're going to talk about the great intensity grades in a minute. The intensity grades really have to do with aerobic. How do I know I'm being aerobicized enough to being moderate versus high, versus very high, versus low? So this is like physical activity. Low intensity. Low activity, right? So when we're looking at aerobic exercise, the World Health Organization, we adopted basically the World Health Organization's recommendations, which were, and we're going to talk about that in a minute, is 150 minutes, which comes out to be 5 sessions of 30 minutes, or however you want to break it up, a week of moderate intensity. So what we've published and what our experts, physical therapy experts, share is that intensity is different for everybody. It's a very personal thing. And when you exercise, that same activity becomes less and less intense because you build more capacity too, right? So something that was a very high intensity exercise, I can do it in 2 weeks and then I'll be like, hey, yeah, what's up? You know what I mean? So because you build the capacity to be able, your body's built the capacity to be able to cope with that exercise. So how we tell people to know this is like, if something's a low intensity exercise, I can keep talking and you don't even notice I'm moving. In fact, if you weren't seeing me, and we were talking on the telephone, you wouldn't know that I was doing this, right? So, but when we get into a moderate, we can still have a conversation. But I'm doing something. You can hear me, right? So it's impeding the conversation, but I can still hold a conversation. That's moderate. What's different about higher intensity is that, oh, yeah, I did say that to that person, but I didn't, so it's really starting to impact on your ability to hold a conversation. So that your inner guru knows that. Good. Okay, so there you go. So that's it. Oh, I had these stars planned, I forgot. It's the middle of the night. You forget what you do in the middle of the night. So, and then here's some barriers that we want to overcome. So this is very much part of the G-Force focus, is to look at the barriers that people are experiencing that interfere between exercise and their desire to exercise and their affinity with exercise. And pain, fatigue, discomfort, disability with prolonged activity, completion time, so again, time is an issue. So if we have a lot of mobility issues, sometimes it takes us longer to prepare for exercise, and that becomes like another burden in our lives. So like thinking about those ways those things that we can do to make it easier for us to incorporate exercise, so it's not such a time demand, if we can. Fear of overexertion, I think you said that. Reduced muscle strength, limited range of motion, breathlessness, I want to talk about that, GI symptoms and depression. Those are things that, and every little movement that we do is great. That's what this is about. Exercise. Every little bit you do is beautiful, just like you. So aerobic exercise, we talked about this. 30 minutes a day, 5 days a week is a good aim to go for, but it's a total of 150 minutes, as long as you're doing 10 minutes at a time, 150 minutes a week at moderate intensity. Okay, those are those grades again. Resistance strength, 2 to 3 times a week. If you're going, in systemic sclerosis, we know we want to go more for endurance. So what do we want to do? We want to use less weight, but maybe more repetitions, right? But if we're going for that other type of strength, you want to load the weights. But in systemic sclerosis, we really want to address muscle endurance. Some things that help with muscle endurance, some types of yoga, repetitive exercises, even if you're not using weights. And this is all in the handouts in the article. Stretching. So stretching is a natural phenomenon that happens. Every animal, I should say mammal. I'm going to say mammal because I'm not sure. Every mammal stretches naturally. And why? Because the muscles know they need it for health. The muscles have to have a little elongation beyond their optimal resting state in order to release toxins, in order to remain flexible, and why? Because that helps to clear the muscle out, improve circulation, but it also, when the muscles have that suppleness, they're also able to protect themselves. Not as much sprain. They can handle shock absorption because they're easy. So that's what's important. Now I want to talk about how to stretch. You see people do this, right? Or people teaching stretching like this. That's no good. So what you want to do is you really want to hold a stretch. So how do I get to the right point? Well, I like to say it feels delicious. Some people don't necessarily feel that. But there's a resistance sensation. So you have this resistance sensation. And you can even try it now with your fingers or your wrists. And so, you can even just press it back just a little bit. You know when you're going too far, and you know where it feels just a nice amount of resistance, and you stay there, and you just feel your diaphragm. In and out. So you can hold it for a few breaths, you can hold it for a specified period of time, and then relax. So that's the best way of doing a stretch. Okay, so no bouncing, and yes, and in systemic sclerosis, you know, different people may be assigned different types of stretching to help them better get through the day and feel more easeful throughout the day. Okay, balance. Every opportunity that you can get, we need to balance. Our feet are so important. I can't tell you how important it is, not how responsive our feet are. Our feet, I keep saying that, our feet. And how supple they are. So every chance, even under the table right now, you could be doing this. And all of these little different sweet articulations and sensations that we're providing to our feet help us with balance, help us with proprioception and messaging to the brain for balance. And then other opportunities during the day for balance is brush up, brush up, brush up, da 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 da. Maybe go the other side. Or washing up. If you're the one in your household who always ends up with the washing up, hey, there you go. Think of it as a free sort of membership to the kitchen gym. So you can, la 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 la. Every time you have a chance to find some balance. And even when you're sitting, lifting one leg when you're sitting can also engage the coordinated muscles for balance and also send that feedback to the brain so the body and brain get much happier with each other in terms of the integration of what it means to balance. Okay. Okay. this is in the article. You'll see this. And so these are our overall recommendations. Exactly what I've already said. And so habituation and self-regulation, self-care and self-retention. This is, again, it's going back to exercise. In order for it to be effective, we have to find the pleasure in it. And the way we can find a pleasure in it is just being okay with ourselves and enjoying ourselves. So it's not so much about beating oneself up or expecting performance. Of course, like I said before, we're going to get frustrated. We're going to get a little disappointed sometimes. We're going to be annoyed about the amount of time it takes to do X, Y, or Z, whether it's preparing for exercise or not. But we just notice that we feel that way. We notice it and we let that feeling be there, that disappointment, that frustration. We smile at ourselves because the most important thing is that we feel good about with ourselves and about ourselves. And at all costs to try to avoid, or when we notice that we're self-bullying, notice we're self-bullying and say, oh, I see I'm doing that again. It's okay. It's bound to happen, etc. And then we move on. The biophysical impact of exercise, okay, this is just more of me going on, waxing on about exercise in a poetic way, but it really does, it dazzles every part of the body. You are your young sanctuary, that was going to be my stop slide for the first half. So it's a growing thing. Exercise is a growing thing in all sorts of ways. It's a growing thing. We get more, we're developing conversation and getting familiarization with our bodies and with our minds and how we interact with our own self. Okay, and this slide is also on your handout, but the slide, it's just a step-by-step mindfulness paradigm. It's very simple. Body, breath, listening to the sensation of the body and the breath. And this is where the pleasure comes in. You're just listening to the tide of exercise in your body, listening to the tide of breath as it moves in and out of our bodies, creating expansion, pressure, massage, the little things that we do create wonderful sensations in our body. And this is the other support paradigm. And that whenever we notice that we're not paying attention or kind of our mind is wandering off or bullying or anything, we just bring ourselves back sweetly to ourselves. And if we had more time, I'd go through a mindfulness exercise with you, but we don't. But it's all about friendliness to the body. This is the point. So friendliness to the body protects the joints, and it creates alignment. Why? Because we're not over-muscularizing. When we over-muscularize and we're whipping ourselves to perform, we're engaging more often the superficial outside muscles rather than the deeper muscles. But we need those superficial muscles to do their business when they need to be doing it and not overtaking what the smaller, finer muscles should be instigating first. And when we develop that balance between those deeper muscles, then our joints can fall better into alignment. And when we over-muscularize through tension, through pressure, through over-expectation, we over-muscularize those more superficial, larger muscles. That's where we can put things out of alignment. And it also sort of reflects over the habits we do. Most of us now spend most of the day doing this. And so we have to think in other dimensions. Okay. So one of the things that I'd like, if you had a chance to look at this video called 331, very simple. You can just look it up on Google, put my last name, 331. It just teaches an exercise regimen that we do, that you take off and do your own thing with. But it's the principles of it. And the first principle is really listening to your body's sensations and listening to the air on your skin, first of all. And developing a kind of cool, airy spaciousness with the relationship of moving. And The other thing that's really important is developing a friendliness with the belly sensation. Nobody likes their bellies, and we're taught not to like our bellies. But here's the paradox to it. If we don't have a soft belly, if we don't like the way it feels when our thigh meets our belly, then we're not going to be able to relax our lower back enough to cultivate a network of core muscles that operate optimally. God bless you. No, don't say that. So we want to develop a belly friendliness that allows for deep, comfortable integration and carriage of the body. So we talk a little bit about that in the video. Yes, and in doing these things, we get soft, pliable, easy joints, and that's very important when we're moving, is that our joints are soft and not held. And the movement is actually in the belly of these muscles, right? And that's allowed to happen when we let our bodies feel the airiness of the movement. Okay, that's all it's been there. So again, this was Urdhva Hastasana, arms up, and actually, come on. Okay, this is Sanskrit, Urdhva Hastasana, which means hands up, arms up. And what it does is it loves on and it helps re-educate. So not only do we have our arms going up and we feel a different sensation, but in ancient, even Native American cultures and Indian cultures, and Buddhism in Asia, this was the primal, kind of most important posture for exercise, because it does all of these things. It lifts the spirits, number one. It opens the chest. It helps with the shoulder and neck, and gives more flexibility to the rib cage. So these are a few things that you can do these days. Okay, we talked about foot intelligence before. 331, I told you about that. You can look it up, and there's also the link for that on the article that Stephanie had supplied. And again, habituation is it. So I think we're going to skip over this because we kind of alluded to all of that. I just want to get onto a few things. What I do want to say is when we think about muscle, we think of large swaths of muscle, like from the thigh and the butt. But muscle is layered with large, medium, small, and they're interwoven with each other. Beautiful network holding us together. And in our face, we don't usually think about the muscles of our face, but there too, there are larger muscles, medium-sized muscles, and smaller muscles for the size, and they're woven into each other. And when we activate these muscles, they can provide circulation and do all the things that I said before that muscle does for our systems, and in a local way, and the same way in the hands. So some eye exercises were considered to maybe help with eye dryness by working on these muscles, doing some simple exercises, for example. Because remember, we talked about how muscle can affect glandular function, and around the mouth and the face. So we've got a lot of opportunity here for helping our systems work better and our circulation work better. Oh, there's the eye one. Okay, so you see we have muscles around our eyes too. Eyeball. Okay, and the tongue! Yeah, so in addition to the diaphragm, singing, talking even. I've really gotten the workout today. The tongue is a huge muscle. So singing is also very wonderful. And so one thing that I do want to say about singing here, I think that's fine, but it helps so much in terms of GI motility, we think, in terms of salivation, and salivation is very important for digestion, for digesting food. So think about when we're preparing food, maybe to sing to ourselves, when we're cleaning the dishes also. You can't sing enough, for God's sake, okay? We used to be cultures of singing peoples. We used to sing all the time. So let's get it on. Okay. Safety and comfort. I'll go through these quickly, that's very important. Okay, incorporating joyful movement, aka exercise, in daily life. We want to start gently. We want to add time and intensity gently in incrementations. I don't expect, and I hope everyone isn't going to go out tomorrow and do 150 minutes for the week, right? But we introduce these quietly, gently, in collaboration with our inner guru, okay? You know yourself the best. It's great to have a yoga teacher, it's great to have a physical trainer, but you know yourself the best. Okay, we've discussed this, yes. You can introduce it in most any way. So habituation again. So your inner guru tracking software. So you notice your feelings of frustration, disappointment, feeling overwhelmed. We talked about all that. I can't stop talking about that enough because I know that people live with this day in and day out, and these are some of the things that are most, that can influence how we feel about the whole day, is our own feelings about ourselves. Surrender to the sensual, the air on the skin, the pleasure of movement, vibration in the muscle like a massage. Every movement is a healing offering for ourselves and others. So even, this is a motivational thing. So sometimes, like, I just couldn't get myself together. I just don't see the point. I just really, I've had so many times where I just don't feel like you don't want to do it. I don't, just feeling down. But then if we think about it as an offering for somebody else or a group of people or the entire planet, who knows? But when it becomes something that we give as an offering, our time to exercise, as a, whatever you might want to call it, whether it's a prayer, whether it's, whatever. It becomes something that we might be more likely to do, and we're actually more wired, based on some research, to do things when we're doing them for others. So we allow our attention to flow on the curiosity of the movement, the sensation, the pleasure, the joy, curiosity about it all. It's not like we're going to do that thing, done. It's a journey, maybe, a curiosity, exploration, that every day is going to be different. It's going to be different because we feel different each day. We have different pains each day. We have different ability levels each day. And wherever we're at, we have to let our body know that's okay. And then we get on with it. So guru equals allowing the conversation your body has with itself to, okay, Safety, very important issues. Hydration, warming before general exercise, warming your body up. Warmth, you might need gloves like we talked about. Know who you are, and if you can exercise without actually having been supervised first and trained first in exercise. Getting out of wet clothes, getting out of sweaty clothes. Don't wait to do that, because bacteria, uncomfortable. Take that time for yourself. Asking for assistance when you need to. Don't be afraid if you go to a gym, if you're out kayaking, you need some help getting the boat out, whatever it is. Everybody needs help in this life. If it's not now, it's going to be later. So be an example to those who are afraid to ask for help, assistance. Aquatic and water exercise, I'm going to talk about a little bit about that in a minute. One thing I did want to say is about breathlessness. Many people with heart and lung problems are afraid to exercise because they're afraid of being breathless, because they feel that being breathless means that they're not having enough oxygen. But being breathless has many reasons, and it doesn't necessarily mean that you're low in oxygen. Low in oxygen is a chemical thing. So the thing is that we can't get fit without getting breathless, because that's the definition of getting fit, right? Because we are going to get breathless. The more our bodies have more capacity, more vascular capacity and muscle capacity to cope with exercise, the less breathless we're going to be doing the same exercises. So we're going to get a little bit breathless. And it's knowing that, so if you know you don't have very severe cardiopulmonary issues, that it's expected. It's okay. And you can even go slow if it makes you feel better, go slower if it makes you feel better. But it's a big point of fear for people, and rightly so. Okay, so the most common reason that people are breathless is because they're not fit enough. That exercise helps us be physically fit. So, and then the other thing that exercise helps us with, which is a little bit related, is dysfunctional breathing patterns. Have you heard of this? This is an area of science now, dysfunctional breathing, disordered breathing. And many people experience disordered breathing. And when you have a chronic illness, this can sometimes get exacerbated because of the trauma of having the illness itself makes us even more anxious. And so our patterns of breathing are off. And what exercise can do, because it's rhythmic, because it's habitual, it can help us find more relaxed and favorable ways of breathing regulation. Okay, so what about flaring pain or after surgery in terms of exercise? Remember, your inner guru, you can find your way, you can always hum, you can always sing. Feet, ankle flexion, extension, morning, waking up, gentle exercises in the bed. All movement is good movement, but keeping moving is important, even if it's a small amount of movement when you're in one of those situations. And again, gentle balancing exercises. So your inner guru will know. So aquatic therapy, we know aquatic therapy is wonderful. Why? Because we notice that there's large improvements in areas that are important in systemic sclerosis. Part of it is that the water provides a buoyancy and a safety, and it also provides a warmth because it should be heated to a certain amount, which makes it easier to move our joints, to flex our joints. It makes it easier to do things like running and kicking sometimes, and so aquatic exercise is very favorable in terms of targeted exercise and also general exercise. But there are some things we have to be careful of. Because it feels so good, you can over-exercise. So you have, and then you can over-exert yourself. So it's important to listen, to kind of know your boundaries. Sometimes it takes going once and then you realize, that was too much. And then the next time you feel a bit, you know your range of what you can do. So it's a wonderful thing for people that have balance and feet issues, and it also just is great because of the whole temperature, water temperature helps to wick away the discomfort that can happen with regular exercise and heat buildup. So anyway, so there you go. And all of this is addressed. Again, safety issues in terms of rinsing off chlorinated or salted water on the skin and then moisturizing afterwards is pretty important. Exhaustion with changing of clothes and being wet at air temperature. These things need a little bit of forethought and addressing, and again, be that example to other people of asking for assistance when assistance is needed. If you need a buddy to go with you to the pool or to the water therapy appointment to help with changing, etc. And again, pacing. Again, preventing against overexertion and gradual introduction. So, and we get asked about massage. What about massage? Massage seems to people like it, and it seems to be good. And I'm not sure whether or not like manipulating the muscles through massage is the same as the muscles actually contracting. I'm hoping somebody's going to do that study soon. But it does stimulate activation of lymphatic tissue and possibly stretching. And people ask about sauna. They say sauna feels good. And sauna may feel good for people who can sweat and who are very inflamed because it can help possibly release some of that inflammatory cytokines through the skin. So you are your healing sanctuary. Our relationship with exercise, it's a growing thing in all sorts of ways. So many things that we can be doing. So many things. Just want to talk about ways that we can begin moving in the morning. We can begin moving in the morning. That's a brilliant place to begin moving and stretching, is just rolling around in the morning. And you know, sometimes for many of us, we cannot get on the floor and kneel and do those things. But kneeling, I want to show you something. But kneeling, doing this doing this in the morning. It's an important stretch for the ankle. And it's important for flexibility and responsiveness of the ankle and the foot, and the interaction of the knee and the hip, the interrelationship of the knee and the hip. So if I'm on the bed, I'm waking up in the morning, I've rolled around, maybe I've move my hands around, get my joints and ligaments lubricated. I can roll over and try to find myself on my hands and knees and move back. So this can be very difficult to do for many people. So one thing you can do is you can just go as back as you, far back as you go, and just enjoy that stretch. You can take your pillow. I didn't bring the pillow from the hotel room. I thought they were going to kill me. But I did make these towels. Pretend it's a pillow. So you whip your pillow around, put it under your rump, and you can sit on that, or a cushion from your house, or a bolster or something. So you can do this on the bed if you can't get to the floor, but these are important stretches for everyday life. I wanted to address something very quickly now that Nancy brought up. I hope everybody can see me. But what about contractures of the hands and doing things with the hands? Can you hear me now? Okay. So one thing that you can do on your bed in the morning, though, like this cat-cow, where your ribs articulate gently like flowing water. But if you have contractures, sometimes you can use towels, or you can use washcloths in different ways. You can grab and fill the contracture space, and then let whatever you're using fall over the top of your knuckles, so that you have some softness there. And you can use this, and you can also do this with downward facing dog, for example. And mostly I tell people to do downward facing dog with the wall or the chair, unless you're being followed by someone. But this is something that can be really, really helpful in adaptation, something simple like this. And you remember, the inner guru is you, inside of you, and so we're all inventive, we're all creative, we all know what materials we have in our own spaces, right? So, that's it. Okay. That's it. So stretching in the morning, stretching at night, gentle stretching. Give yourself that time to move into the world. Let's see. There's so much joy, pleasure, relief in all sorts of exercising. The sky's the limit, and it's all about feeling good and feeling happy in ourselves. And indoor versus outdoor, nature can be really wise. There's studies to show that people experience exercise differently outdoors, and why, in a more favorable way. Well, maybe because we feel the breeze, maybe because we hear, when it's not freezing cold like in Chicago, you hear the rustling of the trees, and what it might be doing is it might be sensitizing our sensation, our sensory self a bit more, so we feel more at ease, and that could be one of the reasons. Singing! Please start singing. Please, for the world, start singing. It's important for all of us. That's all good. So, alone, together, there's so much to be said about being together, but sometimes we need to be alone. Togetherness is important. Feeling connected is important. It's important for our health. People that are connected, people that are lonely and have social isolation, they have worse health outcomes even than people that smoke. So this is a real, if there's one crisis it's in our country, it's this. And supporting each other the way you all do, and you all get together, this is all helpful. So, but sometimes we need to be alone. Alone. I want to be alone. Okay. Do not underestimate the power of group love and humor, gentleness to everything we do, patience with ourselves. And online, there's so much fun to be had, and I want to teach us. So there's this wonderful fun group. Oh my God, I love them. And then there's these walking classes online. There's the body groove online. There's do yoga with me online. It's all great, and I wanted to just show you something that you can do with videos. Is if you didn't know this, you can change the speed, adjust to your own speed. Let your inner guru say what you want to do. So you go there to that gear button. then you choose, that's what it's normally on, normal. This is the 331 video, by the way. That's normal, but I'm like, hell no. And so I'm gonna make it half speed. So, like for example, you're doing the African, they move pretty quickly, so it's a good one to do at halftime. And then if you want to get really silly with your friends and like end up in a giggling pile on the floor, you can do it double time. And then you all just fall out laughing everywhere. Okay, and then you can find me online. There's going to be more from us, from the G-Force team on exercise. If you're interested in getting in touch with me on the calcinosis study or being part of our exercise studies, let me know, and we'll add you to the list. Thank you, and welcome aboard to this wonderful journey.